There's a guy that's got a website called the Vitamin D Council who actually made it available for testing by lay people. So the important part in the background is you can get your own D tested anywhere in the United States, except for 3 states. It's $39. It's cheap. There are some really specific things you have to know about which test you want to get.
Okay.
But there was a website that the psychiatrist in California had established. That was my only teacher. And then I just started giving higher doses. And it was quite clear that as the vitamin D blood level crossed over 60, we all started sleeping better. And I was like, wow, this is weird. So this is a clinical observation. There was this consistent feeling once it got over 60, and between 60 and 80 is the right blood level for better sleep in someone who's had a sleep disorder.
Okay.
That has consistently stayed the same. Okay. My problem is I don't have anybody except me who's been doing this for 12 years. If you're lucky, they actually recommend a blood level. If you're unlucky, they recommend a dose, which is incorrect. Every single person has a different level of deficiency. That means their need for that vitamin D depends on how incredibly depleted their cells are. Some of my patients had to go up to 30 or 40,000 a day. What we've been told is, oh, fat people need bigger doses. That's also completely incorrect. And also that, oh, they're not absorbing it. But if you follow that patient over years, what you will find is as they get better, in the 3rd or 4th year after they're actually going back to work and they're sleeping better and their pain is gone and their gallbladder disease went away and all these other things, now all of a sudden they're on too much. And then they drop down. That means that their body was actually sucking up the vitamin D into every cell and using it. That means that person who takes 30,000 to maintain a level of 60 is using 30,000 a day. Most normal humans, and this is only most, usually wind up at around 8 to 10,000 in the winter, half that in the summer. My American Academy of Family Practice will not give me any continuing medical education credits for anything that has vitamin D on it. All the other parts of the course, and their very first, so they're actually functionally suppressing education about this because it is not current accepted medical therapy. Well, it's not currently accepted. It's never going to be if you don't teach the doctors about it. So vitamin D is attached to everything about our body. What happens if I think I'm a really outside person, which is the way I look at it, okay? And I actually go outside and I don't take D and my level drops back to 35 again. And I'm like, damn, what does that mean, okay? Does that mean I'm not, well, it means that the amount of outside life we have is nothing like it was in the past. We don't really get up and walk outside. I'm not sitting out on my patio now. You know, I'm doing that in the summer, but I'm not sitting right in the sun as I'm talking to you like I would have been when I was raising my sheep, you know, in the past.